Well, good afternoon, everyone, and welcome to today's forum hosted by the Georgia chapter of HFMA. I'm Lil Klug with FAM 360, and I am the Georgia HFMA Forum co-chair. Before we get started, I'd like to review a couple of housekeeping items. All phone lines will be on mute to avoid interruptions during the broadcast. Please submit your questions via the question box at any time. The speaker will provide their answers at the end of the presentation. You'll also find a link to download the presentation in the chat box. The link will take you to the Georgia HFMA website under the tab in case you missed it. We'll also post a recording of today's session in that location. Everyone on today's call is eligible to receive continuing education credits for participating. Be on the lookout for this form in your email. You'll be able to use this form to self-submit your credit on the HFMA website under the Membership Info tab. Now, it's my pleasure to introduce a lovely, lovely lady, Danielle Epps. She is with Windham, Brannon, with more than 17 years of healthcare revenue cycle and consulting experience. Danielle has helped provide strategic operational consulting services to many hospitals across the nation. Danielle is a senior manager in the healthcare advisory practice. In this role, she works alongside the healthcare advisory principal, some of you might know Valerie Burkhoff, to provide revenue cycle transformation implementation solutions and interim leadership support. Prior to joining Windham Brannon, Danielle worked in a hospital operation for a number of years for two large healthcare hospitals in Atlanta, DeKalb Medical Center and St. Joseph's. Later, she transitioned to consulting for a large firm in the Tennessee area. Okay, Danielle, take it away.
Hi, good afternoon, everyone. Thank you so much for joining. I appreciate the fact that you all have taken the time to listen in to what we have to say about price transparency. You know, I want to give you a little bit of backstory as far as Windham Brannon is concerned. Windham Brannon is one of the largest and oldest CPA firms here in the Atlanta area. Not only do we offer CPA services, but we also have 7 advisory practices within the firm, and that includes the healthcare advisory practice. Again, thank you, Lil, for your introduction, and we'll go ahead and get into the presentation. So as we know, price transparency is right on the cusp of the compliance state. But let's talk about, you know, how did we get to the price transparency compliance? Now, the first high deductible health plan was offered by employers in 2001. And then 2 years later, President George Bush signed the law for the Medicare Modernization Act, and that was in 2003. And after that, high deductible health plans gained some momentum. And that was because there was a tax preference that was offered to companies to provide high deductible health plans with some out-of-pocket set aside for the medical expenses, but it was conditional based on the enrollment in a plan that had a minimum deductible of $1,000 for individuals and $2,000 for families. Now that's changed tremendously over the years, and speaking with some other professionals in the healthcare arena, we've noticed, you know, some patients that have had $6,000 deductibles as an individual with $12,000 deductibles for their families. The goal of this was to lower the healthcare costs, and it forced patients to really pay attention to the costs that they would be responsible for after the services were rendered. And again, as we know, on June 24th, President Trump signed the executive order on price transparency. Now, something else that led to this is there was a rise in healthcare consumerism. The traditional plan trajectory started to decline, and the high deductible health plans with HSA and those without started to increase. From 2007 to 2017, there was a 14.7% increase in high deductible health plans with healthcare savings accounts of those from ages 18 to 64, while there was a 13.9% increase of high deductible health plans without healthcare savings accounts from 2007 to 2017. This has created a significant impact as far as dollars to the patient. In 2018, a report from Modern Healthcare indicated that there was a 14% change from 2017 to 2018 for the cost of inpatient services out of pocket for the patient. The outpatient out of pocket increased by 12% just in that 1 year time frame. And then the emergency services increased by 7%. That means really from this study and from the article that was published June of 2019, that 59% of the patients in 2018 had an average out-of-pocket expense of between $501 to $1,000 for the healthcare visit. Now, according to a Gallup poll that was conducted, patients started to delay treatment because of their high out-of-pocket costs. If you think about a patient with, let's just say, a $4,000 deductible, if they need to go for a colonoscopy, they could decide to delay that treatment or that service until they have enough to make sure that they can cover that cost. In 2019, it was apparent based on a US poll that 33% of patients decided to delay their care because of their high patient financial responsibility. And those patients with private insurance, there was the biggest spike because those patients not only have the premiums, they also have, this high deductible plan because the cost of the premium may be a little bit lower. Now, the number of patients with private insurance, they delayed their care in 2005, 21% of patients, but every year since, that number has increased by 30%. Pharma provided some information that indicated that 38% of patients care about their healthcare premiums, deductibles, and copays. From 2006 to 2017, the patient's deductible payment rose over $300. Their payments toward their coinsurance rose about $100. But this is really an important factor for patients because they want to make sure they can receive the services, but the out-of-pocket cost has just started to skyrocket for them. Health Affairs published an article, I believe it was in 2015, that indicated, and as we know as providers, it's very difficult to collect from patients when the balance increases. But as the balance neared, according to this survey, as the balance neared $200, it became more and more difficult to collect from the patient. If the balance was less than $35, according to the survey, 93.8% of the time, the patient paid that balance. But those patients' balances where they weren't paid, they were sent to collections. The Catalyst for Payment Reform published a report card of price transparency across the United States. Over half of the states failed, Georgia being one of them, and some of our neighboring states as well. And that just means that we need to improve, across all of our states as we're nearing the January 1 compliance date. Stephen Brill wrote an article for Time magazine titled Bitter Pill. In this article, he documented where he had spoken with several families. He had done some research on costs and charges in the hospitals. One family in particular, the husband was diagnosed with lymphoma. He and his wife had just recently gone into business for themselves, so they had private insurance. What happened is that they did not have enough coverage to cover the cost of the husband's services and care for lymphoma. The wife had to end up eventually asking her family for help and had to pay around $83,000 before the husband could receive his services and his treatment for lymphoma. So what Stephen Brill documented in his article is that there's inconsistent pricing across hospital departments as well as across hospital systems. Hospitals, according to his article, they utilize some strategic pricing to improve reimbursement. Now that could be from pricing based on the type of payer, department, so on and so forth. And then also hospitals bundled their services differently and successfully confused patients and regulators based on what their charges were. It's a very interesting article that you should probably go back and take a look at, but the stories in the article were just saddening. Now let's talk about the history of price transparency and the legislation. Now, for some time, we've all been discussing and talking about how important it is to be price transparent. On March 23rd of 2010, the Affordable Care Act was enacted by President Obama. Then as we moved along, things started to move forward. And then, of course, 9 years later, President Trump issued the executive order. Now, as of January 1st, once again, 2021, we need, as providers, to be price transparent. There have been some other changes that have occurred, and the government is getting more stringent. There's some more teeth going into this rule. So it's going to be very important for providers to understand, gather their task forces, and become compliant with this rule. Now, here's a few things about the executive order. Again, the effective date, of course, as we know, is January 1, 2021. But now we have a really tight runway, meaning a little over 2.5 months that we have left to become compliant. CMS has already predefined 70 shoppable services for hospitals. Hospitals, however, will still have to select and identify the remaining 230 services to share those gross charges and negotiated rates. Now, if a hospital has identified that they do not supply all of those 300 shoppable services, they must also document that they don't provide that service. Now, the gross charges, those are defined as the charge that is reflected on the hospital's charge master, absent any discount. They must also, as providers, provide the negotiated rates with the third-party payers. And now there are some exclusions to this. That would be your ASCs, your labs, your imaging centers, federally owned hospitals, and other non-hospital sites of care. Now, as far as the Department of Treasury is concerned, let's get into that conversation. So the Treasury Department and the IRS, they were directed to consider ways to expand the use and the flexibility of healthcare saving accounts and high deductible health plans. And issued notice 2019-45 permitted the understanding about the high deductible health plans. Section 223 of that particular notice permits eligible individuals to establish health savings accounts. Now, they have to be covered under a high deductible health plan, and there can be no disqualifying health coverage, meaning that patient's high deductible health plan, that patient would still have to make sure that whatever they are required to pay as far as out of pocket is covered with the use of the healthcare savings account. Now, of course, we know high deductible plans don't typically cover services in the particular year until the patient has covered whatever their deductible is for that year. The Department of Treasury also indicated that there are some services and things that patients need with chronic diseases and things like that. And some of those are asthma-related, diabetes, liver disease, and heart disease. Some of those, services, medicines, things like that, that those patients need, that should be included in what is covered under high deductible health plans and the use of the healthcare savings accounts. Now, the final price transparency requirements. Again, charges and negotiated rates, They need to be available on a machine readable format, meaning if, let's just say Danielle wants to go out to a hospital here in the Atlanta area, to that website, to then understand what those charges and negotiated rates are, I would need to have the opportunity to download whatever that format is so that I can, review that information in that machine readable format. The other reporting requirements are there needs to be a description of the item or service, and it needs to be in a format that a layperson can understand. The standard charge needs to be listed, as well as the negotiated rates, and any of the CPT, HCPCS, DRG codes, et cetera, that we use for those rates, or those charges, sorry. Now, hospitals have the discretion of where they want to place this, but it still needs to be prominently displayed on your publicly available website. And again, CMS has defined 70 shoppable services. The other shoppable services need to be defined by the hospital, and those services need to be those that can be scheduled by the patient in advance of any non-urgent care. The patients also need to have the ability to use a price estimator tool, meaning they need to understand, again, what their out-of-patient cost will be. Some other key points to the price transparency regulation is that there are going to be some monitoring methods. So if I, as a patient, go to an organization's website and I see that there are not any charges and negotiated rates listed for me to review, then I can make a complaint as an individual. But there's also the part of the rule where other entities can report to CMS. Hospitals will also have the ability to audit their own websites and report to CMS as well. One of the marketing advantages is that non-compliant hospital information will be posted on the CMS website, which, that can give other hospitals the advantage. That will let the patient know this hospital is not offering this information. That may lead a patient to then want to visit a hospital maybe 25 miles away if they're not able to understand what their out-of-pocket will be. CMS has indicated that there will be a corrective action plan provided to the organizations that are non-compliant, and there will also be the opportunity to become compliant. There's been an indication that the maximum daily penalty will be $300 per day. That totals to around $109,500 per year, which for large entities there may not be any impact, but for, let's say, a rural health hospital, that could be very impactful to their revenues. And those costs could increase over the future years. Again, the penalties will be publicized on the CMS website. And we've heard from some hospital leaders, it's just a heavy lift, for them and their departments. They don't have the internal teams that they need in order to make sure that they're compliant by January 1. The American Hospital Association has been fighting this, and I believe they're still in the process of filing an appeal to try to ask that this is not in place as of January 2021, especially with everything that has happened with COVID-19 and so on. We wanted to provide you all with some guiding principles. First, again, the final rule was published November 15th of 2019. We also know, number two, patients do not fully understand what their obligations are when it comes to their managed care plans. For instance, you may have a patient who signs up for a high deductible health plan, but doesn't understand that they will be responsible for a certain amount until that deductible is met. Now, as providers, number three, we have an obligation to share with patients what their out-of-pocket expense will be and help them understand it. Patients have been talking about this for a very long time. They have been demanding the understanding of of what their out-of-pocket costs will be. And we really deserve to understand what the out-of-pocket costs will be. Number five, every hospital has the ability to provide the patient with the estimate for their shoppable service. Every hospital. Again, for a smaller hospital, it may be a heavy lift, but there are services, there are offerings that can help hospitals provide this information and become compliant by January 1. Now, when I mentioned before, this is an advantage, it really is a competitive advantage because, again, if I as a patient go to your website and realize that I cannot find the information that I need to determine if I'm going to come to your hospital or another for services based on cost, my out-of-pocket cost, if that information is not available, then I'll most likely want to go visit with the other hospital. So what next? What we recommend is, again, you start with your task force. We know there's only 2.5 months left to the compliance date. But again, the government is really, really putting a lot of teeth into this and want hospitals to comply. You identify your team members. That would be your executive sponsor, members from your revenue cycle, a financial analyst who would help you and your team understand the effects or the impact of complying. You'll want someone from your managed care team because you'll want to know and be able to provide the information as far as the negotiated rates, the de-identified negotiated rates, so on and so forth. And you'll also want a physician champion. The important key to this, though, is to make sure that you only have a small number of team members. If your task force gets too large, it could definitely hinder your progress. And with still such a very short window to compliance, it's very important that you really pay attention to, who we're identifying as your team members for your task force. The American Hospital Association published principles for price transparency. And those principles are that patients need to have easy access to the information, understand the information, and utilize what you're producing or publishing in the machine readable format. You'll need to create your common definitions. Again, you'll want a layperson who is not familiar with what a venipuncture is to understand what that means. For a patient who's not familiar with a specific laboratory test, clinical title, they'll need to understand what that means as well as the hospital pricing. You'll want to explain to the patient how and why those prices vary as far as the patient care is concerned. They will probably likely have questions as it relates to, well, why is this charge different from your organization versus the organization in the same market? You'll want to encourage the patients to understand that price is just one factor. We want to take care of you. So you'll want to make sure you're encouraging your staff to also share their information with the patient. And then you'll want to make sure that you have financial counseling information available for those patients where they may identify, this is a service that I need, but I just cannot afford the out-of-pocket cost. So that information will also be important. Now, you'll want to build your business case. You'll need to define your 300 shoppable services. And again, CMS has informed us through all of the information that they have available that if a hospital does not provide all 300 shoppable services, that they just need to document that information. But you'll also need to understand what's at risk, what services are at risk here. Your imaging, your colonoscopies, your laboratory tests, pharmacies, rehab, and emergency. Again, if a patient is not aware of what their out-of-pocket costs will be for those services, they may likely go visit with a different hospital organization. There may be a huge shift in your market of the high deductible plans that are offered by companies. So you'll want to understand that. Some companies are more aggressive than others. Some payer companies are more aggressive than others when it comes to what their high deductible plans are. But now, according to PwC, 85% of the employers will be increasing their employee cost sharing over the next 3 years. You'll want to know, how do we determine our potential for lost revenue? We don't have a lot of data right now as far as how the consumers will behave or how their behavior will change. But what we do know from the RAND health insurance experiment is that regardless of income, employees with high deductible health plans decided to utilize 25 to 30% less services And so you'll want to assume that up to 30% of your commodity services, again, those labs, the emergency, colonoscopy, so on, that revenue is at risk of shifting because they'll want to go to a lower cost alternative. Now, as far as organizational readiness is concerned, your charge master is really important, right? So, but before you can be price transparent, you'll need to make sure your prices are consistent. And that means across your departments, across within your departments, and across your entities, especially for those larger hospital organizations where there's several locations across the state. You'll want to make sure that those prices are consistent. You'll also need to determine how will your patients access this information? Will it be via your website or an inquiry? Will you want both to be available? That's a determination within your organization, but you'll need to be ready for that. And regardless, you'll want to make sure the patients can find that information easily. I mean, I would much rather prefer that I don't have to go through several clicks to find the information I'm looking for, especially if it's a service that I know I need as it relates to my health. Now, there was another survey conducted by Deloitte in 2012. From this survey, 44% of US consumers indicated that they wanted a pricing tool that would compare doctors and hospitals. Now, how do you define price transparency? That depends on your organization. You'll want to make sure patients have access to your charges and negotiated rates. You want to make sure it's relatively simple, but that's not all they want. They want to make sure that they're understanding what is their out-of-pocket for an insured patient versus an uninsured patient. Most patients want access to health plan websites. But again, the patient payment estimator tools, 44% of Americans want that. And they want an easy to use website. Again, not so many clicks to get to the information that they're looking for, especially when their health is dependent upon it. Some other things that you'll need to think about would be your policies and procedures. What we recommend is that you have, if you don't already have, policies and procedures around your uninsured patient discounts, your underinsured patient discounts, and you'll want to establish financial need guidelines that are easy for the patient to understand and follow, and that you can implement within your organization. Your charity care policies and procedures, your bad debt policies and procedures, Medicare bad debt policies and procedures, and your refund policies will be important as well. You know, we've seen sometimes whenever we provide a patient with an estimate, sometimes the payer has not yet updated what that patient has already paid as far as, or what the patient has already incurred as far as the deductible is concerned. So there may be times where you'll have to refund your patient, but you want to make sure you have those clear and concise policies in place. And then, of course, you'll want to make sure you have your price transparency policy and procedure. You'll want to make sure your staff is aware of what all of these policies and procedures mean for your organization and for your patients. You'll want to update your processes as it relates to the out-of-pocket estimation. If you don't already have this in place, it will be very important, because this will be something that patients will be looking for, let's just say January 1, at the latest January 2. Your scheduling processes and the ease of scheduling based on what's linked to your website. Your financial counseling processes, and that goes beyond your charity care application. You'll want to make sure your patients are aware that you want to make sure you help them pay you. So having, you know, an understanding of what your financial counseling guidelines and processes are is going to be very important, as well as your point of service collection. What does that policy and procedure and processes look like? As far as the information that your patient access staff is collecting, we know that it's very important to have that information at the front of the revenue cycle. Oftentimes, a lot of claims are denied. Patients don't have the right information because of some information that may have been gathered incorrectly at the front end at patient access. We've seen where there's been some patient access staff who just pull old information forward, which does a disservice to not only the organization, but to the patient as well. Lastly, important, it would be your eligibility verification process, your policies and procedures around your eligibility verification. You'll want to make sure that information is accurate. Again, not only for the organization, but for the patient as well. Now, price transparency is definitely, going to be a very difficult message to deliver to patients. So as far as your staff is concerned, having some scripting available for them to effectively and concisely deliver that information to your patients will be important. Your organization's commitment to price transparency will be a message that I'm sure your patients will want to hear. You'll want to have your out-of-pocket estimation disclaimers. What does this mean for the patient? What are we going to do, again, to make sure that the patient can pay us? You'll want to effectively describe to the patient your commitment to helping them pay their patient portions again. And lastly, but not least, your value and your branding. It's more than just a price. Patients want to have great care as well, but they want to make sure that the organization cares about them. Now, as far as, closing thoughts are concerned, I think there have been a lot of people that we've spoken with who have just been crossing their fingers and hoping that the 1/1 go live is not going to occur. That's not the best strategy at this point. We want to make sure that hospitals, are following and they're compliant with the price transparency rule. You'll want to make sure that you make a commitment to being price transparent because, again, it not only helps the organization, but it helps your patient population in your community. After you've built your business case, you should think about, even with this short window, piloting price transparency in your most high volume area and developing a patient focus group so that you can receive your feedback quicker, especially again with the short window. And then make sure all of your stakeholders are included in that feedback so that you're not only sharing what went right, but you want to share what didn't work as expected so that you can make sure that as of January 1, you're prepared, you're ready. Again, this could be a market differentiator for a lot of organizations and where the patients will choose to visit. So think about that importance for your patient population in your community. That is all I have for today. Again, my name is Danielle Epps. Here's my information. And if you have any other questions, I don't think we have any right now, but if you have any other questions or want to discuss how we might be able to help you with price transparency compliance, then feel free to reach out to me or to Lil for that contact. Lil?
Yes, thank you. I'm checking to see if maybe someone has a question. If not, you feel free to go ahead and send an email to Danielle and she will forward you her response. So thank you so much for joining the forum today. This concludes the forum with the last speaker being Danielle. Join us again in the future with any kind of webinars that we may have going on. And I do not see any questions posed. So this ends this session. I appreciate everybody's time. Please be safe. Have a great evening and we'll see you next time. Have a great night.
Thank you, Lil.
Thank you, Danielle, for all you've done. Thank you so much.
Thank you. You too. Bye-bye.
Bye.